So my name is Kristen. I'm a nurse practitioner here at Pathway Pediatrics, and we're here to talk about vitamin K injections today. Lately, there's understandably been a lot of questions about what things newborns need, what's absolutely necessary, what maybe can we wait and hold off on. Vitamin K is one of those things that we've seen an increase in people declining vitamin K at birth for their babies. The main things that I have seen in terms of concerns about vitamin K amongst parents would be that there's a black box warning associated with vitamin K. And that is primarily only ever been seen as anaphylaxis to an ingredient in the shot, and almost always when it's given in an IV injection type of route. So the risk of your child having anaphylaxis to the vitamin K shot is actually very, very low. Obviously with newborns, we're giving it IM, so the risk is even less. Vitamin K is absolutely necessary for newborns to start to develop their platelets. Normally we would get vitamin K through our diet and through a certain gut flora that newborns don't have since they're born sterile. Vitamin K tends to not pass through the placenta, mostly because vitamin K promotes clotting and we don't want clots in our placenta. It also doesn't pass very well through breast milk. So babies tend to not have what they need, therefore they cannot develop the platelets that they need, and this puts them at a really high risk of vitamin K deficiency bleeding. It can happen spontaneously. It doesn't require your child to bump their head or to have an injury. It happens without warning, without signs, and it can be completely devastating. Babies can die because of bleeding in their brain that we can't stop. And by the time that happens, there's just really nothing that we can do to help it. So vitamin K is very important in that aspect, that it can save lives. The statistics are just very stark between the risk of having your black box warning type of reaction of anaphylaxis of 1 or 2 in 60, 70,000 versus a 1 in 60 chance of bleeding. And it's just a risk that we feel as a practice isn't worth the risk. Other things that you could consider to try to help that vitamin K pass through and for them to have enough would be for mothers to supplement vitamin K during pregnancy. There's limited data on oral vitamin K, but it is better than nothing. But we really just encourage parents to really look at the facts, the data, and what the risk versus benefits are with vitamin K. So the major concerns that you would have would be lethargy, pallor, change in their eating patterns, vomiting, difficult to arouse, changes in their temperature. Sometimes they can become hypothermic. There's kind of a multitude of things, but basically in any newborn, if you're concerned that something isn't right, that they're not acting well, you would want to get them assessed very quickly, either in a primary care setting or at Children's Hospital. If you have any questions about vitamin K injections or how to get them if you decided you wanted to get it, please call our office or send us a message through the portal. We'd be happy to schedule you an appointment to talk about it further.